So, I just wanted to talk about healthcare. We've been talking a lot of different topics. We've seen cockroaches with one leg off, and we've seen skateboards. So, a little bit about healthcare. It drives a lot of the economy in Michigan. So, anybody in here who's ever been in healthcare, nurse, physician, all of us at some point got into this field to be able to help people get at the time when they're most vulnerable, which is when they're not healthy. And so that drives all of us, and our family stands behind it. And what I have in front of you is Article 25, a 1948 Universal Declaration of Human Rights. Couldn't say it better. Everyone has the right to a standard of living adequate for the health and well-being of himself or herself and their family. And this right should be universal with some responsibilities. So that drives us, but what's happening throughout the world? I grew up in India, and I came when I was about 9 years old. I was born in a city called Calcutta. Anybody who's been to Calcutta will know how much, how difficult it is to have healthcare in Calcutta. And I grew up in a city called Bangalore. And I tell my kids and my wife that I remember, even as a young kid, that little boys and little girls would come to my door and beg for food. And that vision never left me, to understand how lucky we are in this nation and around the world when you have access to healthcare and adequate resources. But when you look, over 1 billion of us have lack of access to healthcare, over 1 billion. And you see on this slide, 36 million people die of preventable disease, cardiovascular disease, cancer, chronic lung disease, things that are preventable, and because of lack of access, lack of knowledge, lack of information. 7.5 million children under the age of 5 die from malnutrition and mostly preventable diseases, and over 6 million people die of infectious disease alone. Now, if you look at the headlines, you can hear about all the tragedies that happen, but just the last subpoint, 6.7 million people, far, far more people die of infectious disease alone than the man-made tragedies. And the point here is that, we're not doing our job. We're really not doing our job. People are not getting access to healthcare. So why? Physically, what's happening is that you just can't get there. You can't see the doctor. You can't go to the hospital. A brilliant man from India, he talked about the last mile. So you can get healthcare to a certain point, but it's that last mile that prevents us from giving the medication, that prevents us from giving that last bit of advice or the prevention that we need. And you don't have to go very far. All you have to go is to go to 10 Mile and then make your way to 8 Mile. Then you go to 7 Mile. The vast divide that's in our city, in our nation, is that last mile. And we have to fight it. We have to understand it. Grab it and say, what can we do to change it? Financial. We spend a ton of money, some people say not very effectively, for healthcare. But other countries can't afford what we're spending. So financially, they can't afford the medication, can't afford the MRIs, can't afford the CAT scans. So that's another barrier to healthcare. And finally, educational. People don't know that if you have a colonoscopy, you can prevent colon cancer. People don't know that if you use a condom, you can prevent a disease that kills most of their young men. And so there's educational problems. Stigma, that if you go to a doctor, then you're having a problem, and you shouldn't go there. Let's play this video. I just want to show you, we don't have to go too far. If you could play the video for me. Sorry about that. You don't have to go very far to see that the fourth leading cause of cancer death in our country is pancreatic cancer. How little there is known about it just down the street. Hopefully we'll play the video. Are you guys seeing it? No. Any luck back there? So just to set up the scene, we're at the home of our Detroit Lions, and we're asking people what they think about pancreatic cancer. And we're getting a variety of opinions from people about what they say. And it just shows you the diverse opinions just in our city about just something that's that important. And again, the message is that we can look across the globe. You can go to the city I was born in, Calcutta, or you can go to the city that we're living in, and we're talking about Detroit to really get an idea of what's going on. And so for the sake of time, I can just skip the video because I don't want people to fall farther behind. But if you watch the video, one person actually says the pancreas was in their mouth. Another person said the pancreas was somewhere, another part of their body. Some people have no idea what the pancreas was. And it's just we're missing chance of education in our country, in our city. So, it's coming. It's great.
I don't know what pancreatic cancer is.
But I thought it was part of the liver.
Not exactly.
I'm not sure, but I think it's the insulin production for the system or the body.
I know the pancreas secretes something, that's all I know.
An organ? I think, yeah, it's definitely an organ.
I think the pancreas is a filter up under the liver.
The pancreas is an organ down here somewhere, I think. I don't know.
The pancreas is an organ in your body that supplies your body with insulin, which will then bind with the glucose in your body and feed the cells and keep your brain alive.
Perfect. And so what is going on? The people have such a variety of experiences. What is going on in our city and in our country? There's an absolute lack of access. All of you know there's about 50 million, depends on which study you look at, 50 million people without insurance in our country. There's misinformation. You go on the web, you go on television, you go on the radio, you had 10 different opinions of what healthcare is about. And all those factors make it difficult to have access to healthcare. So, I'm a physician, we were practicing, doing well, but I said there's something missing. We've got to do a little bit more. So what could we do? We have all this technology around us. Anytime you're walking around, probably every one of you have one of these little smartphones, they call them. They're not very smart, but they call them smartphones, and you carry around. So we said, could we marry the technologies that we have and do something to impact this? And so Ask Dr. Nandi came about. A television show, not like the television shows that we have now, not sensationalistic, giving a message that's really showing empowerment, showing that, listen, you can have a solution and make an impact on your healthcare. And we were met by a lot of resistance. They said, you can't really do it in Detroit. How can you do a television show in Detroit? You got to come to LA. You got to come to LA. We were told that by half a dozen times. And we said, no, we're going to do it right here in Detroit. We can be successful. And when what happened? It was fall of 2011. Thank God it was a wonderful, beautiful, sunny day. And they said, wow, this is downtown Detroit? I said, yeah, this is downtown Detroit. It's not the image you see. There's nobody getting shot everywhere we go. There's not buildings burning down. This is what downtown Detroit is. So we convinced them after a long time to do this show and to be able to have people come to our city and show that we can do it. And what we showed was, you take a television show, but you integrate it. You integrate it with the web. You integrate it with social media and make one unified message. So the same message you see on television is the same message you see on Facebook, the same message you see on Twitter, the same message you see on Tumblr, the same message you see on Instagram, and unify the whole program. So whether you have one of these, or you have a TV, or you want to watch the show somewhere else when you're, doing your business, wherever you want, you have access to it. And so we said, what can we do to show the folks that are showing this program that the internet and social media is effective? 59% of adults go online for health information. 35% go to get their diagnosis online. And then 72% say, look, you know what? In the last year, I've gone to the internet to get the health care I don't get from my doctor. What about social media? We just think it's our kids. My daughter wants one of these, and I said, no, you can't have it, you're 10. But her friends look at it, she knows. I said the other day, how do you spell this word? She went on Google and started, typing it out. So we think it's just the 10-year-olds, but no. 45 to 64 years of age, 45% of them want to share health information through social media. 80% of young people want to do it. And both doctors and patients think that you can get better, effective, trustworthy health care through the social media. And if your doctor actually publishes in social media, you believe them. And this is the future. This is the future. What's happening is that you go to a doctor's office, all of us have been there, right? My director said it best. He said, Partha, when I feel comfortable in the doctor's office? I said, when? He said, when I'm driving down the street. That's when I feel comfortable. We've made it such an uninviting, intimidating atmosphere, whether you're in a hospital or a doctor's office, that people don't want to go there. But this allows you at least to get an introduction. And if you can do it responsibly, you can show them how to really get the best information without having hindrances. And that's the idea. In a short period of time, I want to show you what our website has done. We're, of course, in the United States, but look at the people that are watching and going to our website. China, Burma, Philippines, India, Sri Lanka, Pakistan, Malaysia, Saudi Arabia, Europe, Australia. From where? Detroit. You know, it's always been, for the last few years, one of my producers says the best. He said, you know, people have always said, how can we help Detroit? Well, for a change, Detroit is helping the world and showing the world how we can do it, how we can get more access to healthcare, how we can better the world, and not just say, wherever I go, your city is bankrupt. How's that going for you? You know, it's going fine. You know, now let me talk about a program that's going to show you how the world can deliver effective healthcare. What about social media? Here's a Facebook message from Sri Lanka. Very simple questions. My blood pressure is high. What can I do? From the Philippines, I am a young man. I want to take creatine. Should I do it? I don't know the answer. A tweet from India. I have dyspepsia and my belly is big. What can I do? From Ghana. I mean, we don't market to Ghana. Nobody markets that we know goes. But the man said, thank you very much. I'm in Ghana. I like your program. Thank you for doing this so we can get the information we need. The idea is that this kind of program, if replicated, can really provide some of the answers to barriers. And then bring it back to Michigan. People as close as West Bloomfield Township was asking me the everlasting question, how can I get a better prep for my colonoscopy? You know? And so it brings it all the way down, from our neighbors all the way around the world. So what have we done? We've integrated our message, made one unified message, answered all our health concerns that people want, and developed a medical community. When like-minded people have information to share, that develops a trust, and we can then, in communities, get good information that can advance healthcare. And as you can see, it's worldwide utilization. So the future is actually now. We can use the technology that you see in this little phone to really remove some of the barriers, remove the misinformation, get people talking about their health concerns so that they can advance. And where does it come from? Detroit. Our goal is to have this program reach every city in the world, and we'd like to create a studio in downtown Detroit with an attached free clinic. When the experts that come from all around the country to volunteer their expertise, I want them then to volunteer to take care of some of the folks in the city of Detroit so that we can give back to the community. And that model can be replicated in any city, any urban area in the country. This is our family that really helped our show, and I want to thank them. And then we always end our show with a saying. It's a beautiful word in the Hindi language that literally means the light in me honors the light in you, and that word is namaste. So namaste to every one of you. And then I want to show you a small 1-minute video of our show, and thank you for your attention.
Good. I'm excited now.
The first thing they told me that, because I go to church, and we have the church in the big dining room.
Yeah.
And they said a preacher was up there just preaching away. And I hollered at him and I said, take your pants down and show us what you got. And they said he just kept on preaching.
He kept on preaching.
He kept right on, and I hollered at him again, I'm serious, take your pants down. And they took me out of church. Can you believe that?
I wonder why. What's the second thing?
Well, there was a doctor come in, and I was after men all the time.
You're after men all the time?
Yeah, they had me set up by the nurse's desk, and this doctor was coming up the hallway, and I said, come here. And he says, what do you want? And I said, come here. And when he came over, I grabbed him right in the crotch.